I'm Kent Justice. Conrad Dove is our tour guide here. Conrad, I want you to explain where we're at, because it's a unique place.
So we're here in the Simulation Center, and what we do here is we train everyone that works at Mayo Clinic, from custodial services to neurosurgery and everywhere in between. We're currently in the office setting, the hardwood floor, and when we step into the tile, we're now in the clinical setting. So this is where we actually have duplicate, exact copies of the rooms that people practice medicine in across the street.
So they get to learn everything just the way it is when they go into that, as you said, clinical setting.
Yes, sir.
So it says patient room 1. Conrad, tell me about this.
So this is one of our standard patient rooms, and this is an exact copy of what one of the hospital rooms look like across the street. So when people come in to train, they train on the exact head wall, the exact bed. The countertops are the same. All this is important because they train in the situation of exactly how they would across the street.
Yeah, and this is almost a real patient, right?
Yeah, so this is a sim man. He's one of our medical mannequins, and he allows us to do multiple types of scenarios. So you could do chest compressions on sim man, you could do an emergent airway on him, you can actually do an intubation on him. His eyes, if you open his eyes and actually shine light, his pupils react just like our pupils react. He can cry, bleed, sweat, he can even urinate. So we can train every aspect of the medical situation.
I want to know about this. It looks very cool, but clearly there's a purpose behind it.
So this is the Anatomage Table. It's a virtual dissection table. And what it does is it allows us to take a thin slice CT or an MRI and create a three-dimensional object. So this is a full three-dimensional rendering of this particular patient.
This is not just some random thing. This is a specific case, a specific patient that you guys have treated here, right?
Yes, sir. If I had your CT scan, it would take me about an hour and I could have your information on the table. And what it does is it takes the thin slice CTs, it stacks them, and then renders them into a three-dimensional object. We can actually take and cut this tissue and roll it open and see inside her head as well.
No kidding.
So this case, everything was outside, but if Dr. Q wanted to look at, say, an aneurysm, we could actually look inside as well, and that's where the volume rendering comes in.
I'm kind of blown away by that at the moment. So we process that. That's amazing. It's got to be an incredible tool for learning, diagnosing, treating, all of that, right?
The tool was originally designed for anatomy training, and it does a fantastic job at that. But here at Mayo, we decided we'll take it a step further, and we want to see how we can use it to actually treat patients. To date, we've done over 40 cases on the table. Anomalies, strange things that the physician's seen that they wanted to see in more detail. Dr. Q has done multiple cases himself. This is one of those cases that's just so obvious that even a layperson can look at it and see what's wrong.
All right, so Dr. Q, come in and tell me what you see or why this makes a difference in treating people who have issues.
Well, thank you, Ken. First of all, I think that Conrad did a beautiful job explaining not only the extraordinarily complex anatomy, but then you simplify. You can actually see the bone, you can see the blood vessels, and in this particular case, the patient, they couldn't find what was going on. They said every time you turn to one side, you faint. People said that doesn't make sense.
Right.
But it was not until we brought the patient, we did a very, very specialized scan with what we call thin cuts. Instead of just a regular scan, there's about 30 cuts. These are hundreds of cuts. And they all got put together in this special machine. And then thanks to the expertise of Conrad and his team, they reconstruct. They do a three-dimensional reconstruction. And then suddenly you begin to make sense of what is going on. And it became very apparent that what we had, which is nothing else but a blood vessel that is very thin, suddenly the bone just moves and completely blocks the flow of blood into your brain. And that's why the patient was having these amazing symptoms. So, number one, it is easy to diagnose the problem once you get to see it in 3D. No matter how good of surgeons or how good of clinicians we are, at the end of the day, this type of technology allows you to identify the problem much faster and precisely. And then suddenly we have a solution that we can implement. And I think that that's one of the major differences on this. This is where technology is taking us to the next frontier, where the patient becomes a partner with the physician and the institution, so that way their health is put at the top as a priority.
What did I miss there? And this is awesome. And again, the guy who doesn't see this all the time is blown away. Anything else you would want to focus on or show me here?
Nope, I just think that seeing the ability to do things like this,
Yeah.
this changes the game.
Conrad, we walked by this earlier. Explain this quote to me.
Well, this is kind of the reason we're here. There's no excuse today to learn on the patient. Dr. William Mayo said that in 1927, and it was amazing that he could see that far into the future and say, you know, we don't need to practice on our actual patients. We need to practice in a safe setting, and that's what simulation does. It provides a safe setting. If you're going to make a mistake, make it in simulation. That way, we can tell you what you can do better, and when you go across the street to interact and deal with a real patient, you're ready and more prepared.
Well, we are more prepared for what we see here and what Mayo does, and I'll tell you, it's pretty amazing. This is a great opportunity for you as well. At the Players, at the Vendor Village, this is where the Sim Center folks will be. You'll see all the technology we've just showed you about. You'll get to meet staff, some of the physicians, and understand what Mayo provides, not just in our region and in our country, but across the globe.